This week we look at the latest tech being used to combat cancer. Lara hits the lab to see how AI and robotics are being harnessed to create new treatments for the condition.
We uncover the new blood monitoring system aiming to give cancer patients more independence.
I just fell in love with the machine. It gave me a little bit of control back as well.
We meet the robots with a sense of touch.
So how did you sleep last night?
Did you sleep well?
And Spencer looks at how a video game engine can make movies.
We can move the shard, which does make me feel more powerful.
According to Britain's biggest cancer charity, someone is dying. We now have technologies like AI and robotics, which are helping us to discover more effective drugs with fewer side effects quicker.
One in two of us will be diagnosed with cancer in our lifetime. 1 in 2. For years, treatment has been centred around surgery, chemotherapy and radiotherapy, sometimes a combination.
Cancer therapy has evolved over the last 2 decades, in particularly shifting away from chemotherapy for every patient and for every cancer to personalized treatment. In some cancers, we have really made great progress. 10, 15 years ago in melanoma, where survival rates, median survival rates were around 6 to 9 months. Now patients survive years.
Standard cancer therapies can be incredibly tough to go through, and one of the great new hopes for kinder treatment is immunotherapy. That's drugs that work alongside your own immune system to kill cancer cells. Scientists here at Lab Genius in southeast London are harnessing the power of robotics and AI. They're hoping it'll help them find new immunotherapy treatments and make existing ones better. There's a lot going on in here, some of it by automated machines, some of it by people.
That's right. So the different thing about what this machine is doing and what you might envisage or see happening in a normal lab is all of the experiments that has actually been designed by an algorithm.
And all of the data you're using is your own data?
That's absolutely right, and actually that is a really, really key point. And we want to build models that are predictive of certain biological features of interest. And the challenging thing for us is that data that's required to train those models, it doesn't exist anywhere in the public domain.
But it's not just these few machines I've seen, it's everything. EVA is a smart robotic platform synthesizing, purifying and testing molecules using machine learning and the clout that comes with cloud computing. And this room's the final bit of the lab process to make sure that the molecules are tested for purity, that they can withstand changes in temperature, and crucially, that something has been created that can be produced at scale. Lab Genius says that with its unique approach, it's more likely to find high-performing treatments faster, and they have tested that claim.
We took a molecule that's currently in clinical trials.
It's an immunotherapy drug,
It's an immunotherapy, that's right, currently in clinical trials. We took the one that's furthest along, and we said, can we use this process to make molecules that are any better than this? We were hoping for a 10-fold improvement in that molecule's ability to distinguish between healthy and disease cells. But what we actually found is that these machine learning models were able to deliver molecules with 400 times improvement in terms of their killing selectivity. So really, orders of magnitude better. These are molecules that, as a protein engineer, you would never have sat down and designed yourself. And I think that's something that's really quite differentiated and special around this fusion of human ingenuity and machine intelligence.
But they want to take this to the next level. Cancer cells are densely covered in surface markers that distinguish them from normal cells. And it's these markers that molecules developed by Lab Genius are targeting. They're called immune cell engagers.
One part of the immune therapy is targeting a very specific cancer protein or receptor. The other part is inviting T cells to join the party and really attack cancer cells. So this is version 2 of targeted immunotherapy. It's a very pinpointed approach. You can attack much harder and with much less collateral damage. I particularly believe the preclinical development, which is now through companies like Lab Genius, much more condensed, much quicker, supported by the right regulatory framework, much quicker. And it really, historically, where drugs took 10 years to be developed, will bring us down to 5 years and even quicker sometimes. Will we cure cancer? I think that's still an open question, but better understanding of biology, a more targeted approach will help us getting most of our cancer patients surviving good quality of life for many years to come.
Wow, it really does feel like we are getting there with these cancer treatments. I know it's always going to be slow progress, but this is another example of the power of big data.
Yes, and what really stuck with me from that day was the testing of drugs on healthy cells. Because many experts have said to me the big challenge isn't creating drugs to kill cancer, it's developing tolerable drugs to kill cancer.
Right, of course, yeah. Okay, well, next, Shona McCallum has been looking at some new tech which could help to monitor cancer patients at home rather than in hospital.
Cancer has dominated Lynn's life for the last 7 years.
You get CT scans, you've got MRI scans, you've got blood tests, seeing the doctor, you've got all these other tests and things, and it does feel at the very beginning that every day there was another appointment coming through. It's exhausting, physically and mentally. You're just waiting and waiting and waiting.
She's spent a lot of time away from her beloved cat Sunny getting chemotherapy and blood tests in hospital, something she's always found stressful.
I don't like needles, I don't like having bloods taken. You can be waiting 2 hours for the results if the analyzers break or something goes wrong. It can be 3-4 hours before you get your results for the blood tests. Sitting in that blood room, getting more and more anxious, getting hotter and hotter. By the time I would go into the chair, I would probably, I do faint.
But Lynn has recently had access to a tech solution that she says has made a huge difference to her life. To do a quick finger prick at home instead of a full blood test at the hospital.
You can do it the day before you have your treatment or the day before you go and see your consultant. When you want to do it, you've got that little bit of control over your treatment and your time. I can do my blood test and I can go and do something else whilst it's being analysed. And the one thing that I did like about it as well, I didn't have to keep going and being reminded that I had the cancer.
The kit has been designed by health tech company Entia and is the world's first remote patient monitoring solution for people undergoing cancer treatment. The Liberty has just had regulatory approval and is in the early stages of being rolled out to various hospitals. Here at the Christie in Manchester, they were one of the first places to try out the tech. Absolutely packed, an all too familiar sight in a hospital waiting room.
If you could do the test at home, you'd be far more relaxed. You wouldn't be worried about the appointment times, the waiting rooms, particularly if you're feeling ill and tired, and it's just a worry for you, another anxiety whilst you're going through your treatment.
What would it mean if you could do this process at home using...
It'd be amazing. You wouldn't have to get childcare and you wouldn't have to worry. And you're more comfortable at home, aren't you? You've got your own comforts. Coming here can be quite scary sometimes.
And reducing patients coming through the doors was one of the reasons this hospital took a punt on the tech.
What we've done recently at the Christie is actually positioned phlebotomy units around the region. So we now have 10 or 12 units around the region, what we call bloods closer to home. And so the patients can book in themselves to have their blood tests, but it still means we have to staff those units in order for the patients to be able to have the blood tests. If the patients were able to simply get those blood tests done or do them themselves at home, that would result in significant efficiencies. And that's really important. We're not trying to distance ourselves from patients, we're trying to make their lives easier.
And during the clinical trial, the medical teams found that the blood testing at home was just as good as in the lab.
And then the next thing, of course, is how acceptable is doing the bloods at home to the patients. And I'm very pleased to say that it's a highly acceptable approach to the patients that we've tested this in.
They also found it easy to use. The results from the devices are easy to read.
I can see the white blood cells, the neutrophils, the haemoglobin and the platelets all on the screen.
And it meant a lot less of this, giving blood, which many patients find particularly difficult. So what is the ambition for this bit of tech?
So now that we've got regulatory approval, we're sort of really actively engaged with many NHS centres across the country and really looking at new clinical use cases that this solution can actually be applied to.
But it's not too onerous for them, is it?
Yeah, so everything that we've done at Entia has been designed to offer patients a very simple journey. I mean, we are not trying to medicalise patients further. We're really trying to take them out of a hospital setting, placing them back in the community, in their homes, in a place that they really want to be, and to provide them with tools that are very simple and intuitive to use.
So it looks like there will be more patients like Lynn who will get the chance to access their liberty. But given the volume of cancer patients across the country, mass adoption is still a long way off.
I just fell in love with the machine, to be really honest with you, because it gave me a little bit of control back as well.
A precedent is being overthrown, and trials of a new cancer drug show promise.